One really can't imagine life without a beating heart. But mind you, this heart beats to the tune of your income. If you belong to a poor strata, this is going to trouble you in a different way. If you're from a middle class, it can make you hypertensive. And if you belong to a rich class, you might be in for an attack. This is not to scare you, but to make you aware that the cardiovascular diseases are on the rise these days. And if rightly said so, that cardiovascular diseases are number one public health enemy these days. Keeping this in view, WHO, the World Health Organization, has decided to celebrate its day, that is 7th of April 1992, as a day when they are going to make people aware of the cardiovascular diseases. Keeping this in mind, they have come with a slogan, Heartbeat, the rhythm of health. This is to make people aware that which strata is going to suffer from which disease and how best can they cope up with these problems. For instance, the people who belong to a poor strata, children in that strata are likely to suffer from rheumatic heart disease, whereas the people who belong to a middle income group, who are tense, who are working in the offices, who have other problems to cope up with, are likely to become hypertensive, may go in for cerebral attacks. And the third category which I talked about is the rich class, which is likely to go in for ischemic heart disease or heart attacks. We had a chance to talk to Regional Director, Southeast Asia region, Dr. Yu Koko. Let's hear what he has to say about the World Health Day this year.
On 7 April 1992, we would be celebrating World Health Day, which in fact is the anniversary of the founding of WHO in 1948. The constitution of WHO was drafted and agreed in 1946 after the series of meetings among the member countries. But on 7 April 1948, the constitution came into force. And from that day onwards, every year, we celebrate the World Health Day on 7 April. Every World Health Day, the WHO picked up a center theme, which is of a topical subject to alert the world community on the importance of some aspects of health. This year, for 1992, the topic we have chosen is Heartbeat, the rhythm of health, which is to alert to the people the importance of the various heart diseases and the bringing to the attention of the people that even though this is very complicated and difficult clinical situation, this is not that difficult to make preventive measures. And it is estimated in this world today that there can be as much as 12 million deaths a year from these heart diseases. And very roughly speaking, about 6 million in the developing countries and 6 million in developed countries. But the problem is from now on, because of the changing world situation and the trends of the health and the demography in the developing countries, it is possible that in the next decade, the number of deaths from heart diseases will increase in the developing countries unless we take some action. In conclusion, I would like to quote Dr. Hiroshi Nakajima, the Director General of WHO, who said, quote, "By devoting World Health Day of 1992 to the theme of heart health, it is the aim of the World Health Organization to increase public awareness of the worldwide dimensions of cardiovascular diseases and to sound an alarm against their spread." So we are hoping that by spreading this information to the general public, the communities, the families, workers, we hope that people can take care of themselves and try to live healthier by adopting the healthy lifestyles and prevent themselves from becoming the victims of cardiovascular diseases.
What was the problem really?
Actually, I started feeling uneasy. Then I came back from the office in the evening and I started having palpitation. So we called a nearby cardiologist who asked me to immediately proceed to the hospital. So that is how I came here.
Did you have the same kind of palpitation ever before also?
Yes, I had a couple of times before also, but that time also I came to the hospital and I was put on some medicine, as a result of which I was feeling better, not better. This time also, this last episode occurred about 3 months back. After that, whatever medicine Dr. Lochan gave me, I was feeling perfectly all right. I came here this time not because of any problem, but because of this surgery. This EPS test which has to be carried out.
Means ever since you have started on medicines, you didn't have the palpitation problem again.
One or two times.
But the intensity was less.
Yeah.
So this time you have come only for some investigation so that you can be treated better.
Yes, this time I came for this test.
I think Dr. Lochan has been treating you.
Yes.
It will be lovely talking to him also. So Dr. Lochan, I'd like to ask you one very simple question. As you are also aware that every year 7th April is the World Health Day, and this time the slogan is somewhat related to the heart and something to do with the rhythm of the heart. And here's a case who had palpitation with abnormal rhythms. May I ask you, what are the problems which are likely to be there which create this kind of rhythm problems?
Basically, as we all know, rhythm of the heart and the heartbeat is very important part for the maintenance of the life, and its rhythm is also very important, whether it is fast or slow. If it is very slow, then we have problem. If it is very fast, we have problem. This patient had a fast rhythm problem. Like that, if it occurs suddenly, it can stop circulation of blood, which can lead to sudden death. And as such, that is the number one killer nowadays because of the sudden problem in the heart rate. Now there are ways how one should deal with it, and Mr. Hegde came to us for this investigation. We are looking into it with the help of ECG, with the Holter monitoring, how we can see it, and electrophysiology, by which we can detect where the heart rhythm is starting abnormally, in upper part of the heart, lower part of the heart, and what is the magnitude. And then we can look into it, what are the treatment modalities appear present with us.
So once Dr. Lochan, there are abnormalities in the rhythm of the heart and you have found out how exactly it is happening. Can you tell me how do you manage them?
Well, management depends in two parts. One is the acute management at the time when patient comes with the abnormal heart rate, and that usually requires some drug therapy to give in, some injections to be given at that time. If they are not responding, then there's some electrical treatment which we can take help. And second part is the prevention, that they do not occur in future. So they can be avoided, number one, by some drugs to be taken in long term. Secondly, by some preventive measures, non-pharmacological, which means like if the problem is because of the lack of blood supply to the heart, so maintaining a good lifestyle, which means that maintaining a regular exercise to keep yourself fit, and having less strain on the heart, mental as well as the physical. Also keeping a good diet, which means good diet not in calories or quantity, but what I mean a good diet is a low calorie diet, having a high fiber diet which keeps the low level of cholesterol in the blood and helps in other problems of the heart disease.
It is not merely the socio-economic strata which makes you more vulnerable to the heart diseases, but there are other risk factors too. For instance, if you are a lazy person, you are likely to have a limping heart and with a bad health, and likely to go in for lots of problems of heart which will incapacitate you from doing day-to-day work. At the same time, if you're fond of eating, you eat too much of salt, too much of fats, and tend to relax at home all the times, you're likely to become overweight and you're inviting again the cardiac problems for yourself. Similarly, there are so many other factors like tension. If you stay tense, you're likely to create problems again for your heart and your body. And last but not the least is the smoking. It may be active smoking, that is if you are smoking, or it might be a passive smoking. When you're sitting close to someone who is smoking with you, you are likely to get the cardiac problems again. So here we always stress, smoking is the most important factor which leads to the heart problems, besides being tension, high fat diet, high salt diet, and laziness. So to make you aware, we had a chance to talk to one of the leading cardiologists of our city. Let's hear what he has to say on this occasion.
Every year, World Health Day is celebrated on 7th April. This year, the slogan is Heartbeat, the rhythm of health. Heart, as you know, is the most important organ of the body. It acts like a pump and supplies oxygen and nutrients to every cell of the body. In my country, there are three major classes: poor, middle and upper, and I may say there are three major diseases afflicting each group. Rheumatic fever in the poor classes with overcrowding and poor socioeconomic status. Middle class, hypertension is very common, and the richer classes, the ischemic heart disease, also called coronary artery disease, which produces so-called heart attack. With industrialization, as we become affluent, it has been seen all over the world that the incidence of diseases, particularly the heart diseases, increases. Is it possible that as India increases in industrialization, becomes more affluent, we could maintain the tempo of the heart diseases at its present level by preventive measures? A country like ours cannot afford curative medicine, which is very costly. Therefore, we should lay stress on preventive medicine. The slogan for this year may be prevention.
Prevention works. It can save 6 million lives each year. Cardiovascular diseases need not to be a leading cause of death. Our goal for the year 2000 and beyond must be cardiovascular health for all.